Hello and good afternoon. Thank you for joining us for MFA's 30th Annual International Conference and first ever annual virtual conference. This is Jason Aslanian, Membership Experience Director of the Medical Fitness Association. Thank you for attending today's keynote speaker titled 2020, The New Norm, an Opportunity for Transition to True Healthcare by Dr. Marty Miller, Director of Education and Training at Technogym. Dr. Miller is the Director of Education and Training for Technogym USA, who has more than 20 years experience in sports medicine, performance enhancement, and injury prevention. His academic credentials include a BS in sports medicine and physical education from Canisius College and an MS in exercise science and injury prevention from California University of Pennsylvania, and received his doctorate in health sciences from AT Still University in Mesa, Arizona. Marty is a certified athletic trainer with the National Athletic Trainers Association, a performance enhancement specialist, corrective exercise specialist, and a mixed martial arts conditioning specialist. Please type all questions in the section of your toolbar throughout the seminar. All questions will be answered at the end in the order they were received. Dr. Miller, take it away.
Awesome, Jason, thank you so much. And to the MFA, thank you for inviting me here for this amazing presentation. I remember when we talked about it months ago, we really wanted to do it live. We were hoping that everything would change, but hence the title here, 2020, The New Norm. We adjust, we make changes, and nothing's gonna stop us. We're gonna get out there and do amazing things for our partners and or our customers. So I'm truly excited for this, and feel free to ask questions. There will be time at the end, and you'll also have my contact information at the end, just in case you need to get a hold of me. So again, I hope you guys are doing well. This has been a very unique year. But to start out the topic is every unique opportunity provides us a really good time to reflect. Are we prepared for challenges? Could we have seen these challenges coming, or how do we adjust quickly to these challenges so that way we can operate in the space that we are, maintain our market share, our market penetration, and or possibly utilize this transition to the new norm to increase our reach and our ability to help our clients, customers, patients. So I really enjoyed putting some of this together because we got to look at the current research, and really I can kind of craft the story on what we did with Technogym, because this was a very unique year for us as well. So for those of you that may not be familiar with Technogym, Technogym was founded in 1983 by Mr. Nero Alessandri, who you'll see down here in the right corner. Interestingly enough, 35 plus years later, Mr. Alessandri is still running the company with that same drive and passion as he did when he founded the company. Now, we are based out of Cesena, Italy, so central Italy, more towards the East Coast, closer to the Adriatic. And Mr. Alessandri has left the company in his home region and has truly created this lifestyle for the entire region. It's one of the healthiest regions throughout all of Europe. And you're going to find that our company is really, truly focused on people living healthy lives. It's not necessarily about how much equipment can we sell. It's how do we impact people to live their healthiest lives. So what you see here is the Technogym Village. This is still, as I said, in Cesena, Italy. This is our headquarters. And normally I get to travel there 4 or 5 times a year. Clearly this year I won't be able to go, and I'm really sad about that because it's such an experience every time we go. But the reason I like to show this picture is to show the beauty, but also the dedication to research and design that Technogym has. And when I say research and design, that is at the highest levels. So when you look at this amazing campus, in the front is our 2-story showroom, and that's where all of our equipment is. And the beautiful thing about it is our employees take an hour and a half mid part of their day to go exercise and to be that wellness and to live it by example. And then there's a beautiful restaurant on property that is all homegrown foods from the region. So again, we are living that lifestyle and practicing that lifestyle in everything we do. But what I really like about it, and this is why I've missed going over there, is this whole bottom floor that you see is our research and design and development. Technogym has invested in over 250 people just in our headquarters for R&D. And that's going to really highlight our commitment to excellence and commitment to the data and the unique opportunities that we have to provide all of our partners, like all of you on this webinar, with some of the most amazing tools, resources, whether it's digital, whether it's product, to extrapolate amazing data so you can now give your customers the best experience possible and the best outcomes. So being someone from the medical side as an athletic trainer, it's all about the data. It's all about evidence-based solutions, and that's what we are. That's in the DNA of the company. And Mr. Alessandri named the company Technogym back in 1983, understanding technology was going to be the future. And boy, oh boy, when we talk about 2020, was it important to have that digital technological component to stay in touch with our customers. So another thing that I love to highlight is one of our partnerships is Technogym has been chosen to be the sole provider equipment for the last 7, would have been 8 Olympics this year in Japan, and hopefully I'll get to go next year. But the reason I highlight this is this isn't something that Technogym pays for. This is something that Technogym is chosen for due to the fact of what we represent as a company. But what I'm so proud of Technogym with this partnership is they didn't just go and provide equipment. They went and used it as the best case study in human performance ever conducted. You've got male athletes, female athletes, power athletes, endurance athletes, and you've got the greatest strength and conditioning coaches, athletic trainers, physical therapists, medical doctors, PhDs, all coming together worldwide. And this is how we continue to build our partnerships so we can continue to push the envelope in research and development and design and come out with just the most amazing solutions for all of our partners. So my role is a director of education and training in North America. So I get to bring all of this amazing content into all of our partners. I get to work obviously with our sales team, but truly my role is to be that conduit from headquarters and then obviously work with all of our partners to make sure that everyone gets all of the unique features that our equipment is capable of. So I just want to go over our vision and mission. So the vision is simply this: to help people live a better life. And this is why our partnership with NMFA makes total sense, because obviously Medical Fitness Association is striving to do the same thing. Yes, there's a business model underneath, there's no question about it. But if you don't have the why you're in business first, sometimes it's harder to conduct your business. So simply, all of us here on the webinar today, we got into this industry because we want to see people healthy. So the vision of the company is to help people live a better life. Now, we understand wellness, and I'm going to pause here for a second. Wellness is a term that has been probably overused a little bit now, but we've been the wellness company for over 20 years, again, being that forward-thinking leadership company in the whole industry. We've been using wellness as what we do for eons, and that's why I showed the village, because people live a wellness lifestyle at work. So clearly here, it's promoted by Technogym, it's in our DNA, it's all of our employees are passionate about that. So we offer innovative and engaging solutions to help people achieve personal wellness, educate them as to the benefits of movement and that healthy lifestyle. What guides us and unites us is that belief in wellness as a social responsibility. And I'm sure all of you here have that same feeling that you are the conduit to your communities to get people to be healthy. And then the mission, of course, yes, we want to become the world's leading solution provider. So you can see there, it's not equipment provider. We don't just manufacture equipment. We manufacture wellness solutions that we can bring into our partners so they can then help people live a better life. So we're very committed, without a doubt, to being recognized as the benchmark in the sector by virtue of our ability to offer a true way of life, providing tailor-made solutions for end users and industry professionals in the field of wellness. Not just equipment, but services, content, devices, and networking solutions. So again, we take all of those best practices from our partnerships, all that evidence-based research, and then we can deliver the best solutions to you so you can get into your community, get more people engaged, and get more people the results they're truly looking for, so that way you have a successful business. So today, now that I've introduced myself and the company, we're going to discuss the current state of the medical fitness industry due to this 2020 health pandemic. We'll discuss the most recent and relevant statistics, how different populations are affected by disease. Then we'll discuss opportunities the medical fitness industry has to lead the change in healthcare, as well as improving overall community health. And Jason did do my introduction, and we talked about that I went and did my doctorate. And I was very, very close when I was deciding my dissertation, and I will bring this up later, but do we really have a healthcare system, or do we have a disease care system? And I'm talking to professionals. You guys all know that we have phenomenal healthcare, but really what we do is we can keep sick people alive for very long periods of time. But we at Technogym, and you all here, we want to be able to treat those individuals and switch them to that preventative care, or get people early on. I have 3 young boys that are 21 and my twins are 19, trying to educate people at a very early age on how to live that healthy lifestyle. And there's some tricks to that now with what's going on in the fitness industry that we're going to talk about, and some trends that I think that will be very important to really helping you and the Medical Fitness Association really be the benchmarks in the industry. So right off the bat, yes, we're going to talk briefly about COVID. Took the world by storm. No one had a business plan to handle shutdowns, and here we are again. And we're a European company, and we know what's going on throughout Europe, that they did a very strong lockdown in the beginning, and now they're doing lockdowns again. We'll see what happens here in the United States. Hopefully we can avoid that. Time will tell, and again, state by state, because we're such a big country. We're as big as Europe in general. So we'll see how that goes. But some statistics back from April. More than 185,000 people from all 50 states had agreed to participate in a virtual research study that would track their attitude, behavior on health, over the course of this pandemic. So we're going to study and look at, what did these people think about, and how did they react and respond during this time period. And now this is going to be very relevant to maybe what might happen again if we do have the spikes that we're seeing, and potentially, how people are going to react. Are they going to follow the same statistics that we show here, or are they going to buck that trend and maybe go in an opposite and different direction? So some pretty cool statistics. So one of the ones here, you'll see the question was, in the past 2 weeks, have you experienced any of the following with regards to your general ongoing medical care not related to COVID? So you'll see here the first one, medical, had to miss or cancel previously scheduled appointment, or unable to get in-person appointment to see their provider. 33% were impacted. That's a big number if you're the business operator. Then for prescription drugs, unable to obtain the prescription drugs they need, or have stopped taking them as prescribed to extended supply. 7%, and that can be very dramatic depending obviously on the healthcare situation. Now this one I really liked, I spent some time looking through this one. I find this one very interesting. So disruption to medical care outside of coronavirus for 8 major conditions. So again, the question was, in the past 2 weeks, have you experienced any of the following with regards to your general or ongoing medical care not related to COVID? So all conditions, 36%, that's pretty drastic. You can see here 45%, asthma 39%, chronic pain 52%. And we all know how much chronic pain leads to inactivity, can lead to other health conditions. If somebody can't move well and can't walk and do their exercising, all these other conditions can be exacerbated. Hypertension, migraine, rheumatoid arthritis, and type 2 diabetes. So a lot of these are behavioral based, some aren't, but you can clearly see that that's a major disruption in the 40% or higher for all of them. We have 39 here with asthma. So very concerning to all of us here who are trying to get people, and potentially for us who may deal with sick people more than the general fitness industry, to maintain their health during this stressful time. So here you'll see seeking care. So health concerns, again, outside coronavirus, with regards to maintaining your health through ongoing medical care. Were you able to see your doctor, obtain your medications? How worried are you? So now we're going into their projections on what they may be able to do, maybe not be able to do, and how this is going to truly impact them. So you'll see here that now this was a while ago in April, that 20% were worried or very worried. And I know that I'd seen some other statistics, but I want to stick with this whole study, that it even peaked higher than this, because April was a little early on, but they did a very nice job with this study. And then here, in response to coronavirus outbreak, how worried do you feel about going to doctor's office or hospital, including the emergency room, for necessary care not related to coronavirus symptoms? 42% were worried or very worried. Now, I can give you some of my own stories. So I'm going to have a procedure this week, just a routine, a medical checkup, but I had to go get a COVID test ahead of time. And again, going through the process of, nobody else can come into the office with me. And I had to do the coronavirus test out in my car. So again, people have changed their business model now to adapt. Now, I live in South Florida, so we will always have the advantage of being able to utilize open spaces more so than the majority of the country. And then my wife had a medical procedure and she had to go to a, like an MD now. And again, all those procedures have changed. So here we are operating different types of medical fitness association businesses throughout the country with different local laws, but people are very concerned. And how are we going to address that so they feel safe, the staff feels safe, but yet you can still have a viable and operating business? Now, telehealth, this is very important. This is a trend that we've all seen coming, and we know that there was going to be a major uptick during this time. Now, I'll pause again here because what we have noticed with Technogym being a global leader, so we're in 14 countries. We have our own operations in 14 countries, plus we work with hundreds of distributors throughout other countries. So we've got a great sample size of the entire world. That digital connectivity is vital for the survival of all businesses. I'm going to cover that more on how this can be effective to all of you in the Medical Fitness Association. But clearly, telehealth is here to stay. And we, again, in my family, utilize that the other day to make sure that, one, it was just more convenient, and two, we didn't have to travel to a facility while my wife wasn't feeling well and put her in an environment that maybe potentially could be, something that she could catch any type of infection. So again, it's here to stay. And what I like to say is people's habits have changed. This pandemic has been long enough in duration that people have changed their habits, and businesses have either changed to meet those new habits or they have not. And I will, like I said, cover that as it comes to MFA and other fitness environments here shortly. So you can see 39% have utilized it, only 2% unable, 59 did not, and the success rate is really good here. Live video, phone, text, or email. I'm sure some of you have utilized it as well. Now, switching into fitness, and then we're going to merge these two together. So Technogym has different lines of business. We have our club segment. We have our HCP, which is health, corporate, performance, which the Medical Fitness Association falls under. We have our hospitality and residential. So we have military. So we have a great understanding of what goes on throughout all the lines of business. And URSA, which I know you guys have just recently partnered with, has great numbers, great statistics, and can really share patterning of what people do across the country. So when you look at the number of health club consumers in the United States prior to COVID, it had increased from 58 million in 2010 to 73.6 in 2019, a very healthy 27% growth. And then the other number that I like here, the average attendance for health club members had increased from 97.5 visits per year in 2010 to, let's call it 110 visits, 12% growth. So great, we got more people and we've got more people using it more frequently. The US, and again, this is not shocking to us being an international company, leads all markets globally in memberships, 64.2 million memberships in 41,370 facilities with the revenue of roughly 35 billion. So that was at the end of 2019 prior to COVID. So when you look at what's happening, there was a lot of facilities, bricks and mortar facilities, that really focused on the experience in the brick and mortar facility. They understood that people came for a sense of community. People came to get out of work, out of their house, to have an experience. Well, now, due to COVID, things changed drastically. Again, I'm going to cover some of this as we go, but I really like these statistics to show more people are basically interested in being healthy. But let's take one step forward. So you saw all those statistics in the increase. And now we see that due to COVID, there's a 48% decrease in activity, and it happened quickly, right? It wasn't a gradual thing. And being an equipment company, boy, oh boy, did we receive calls on what can you deliver to my house? Do you have dumbbells? Do you have this? And throughout the industry, home equipment became very important and a very scarce commodity. And I'm sure all of you had to adjust, at least for those 3 to 4 months, depending on where you live. I'm lucky being in Florida. We opened up quicker. I was back in my gym, I want to say before July, and was able to get into a facility. And knock on wood, thank God, we've still been able to operate and be in our facilities. We'll see what happens. But for 3 to 4 months, even I had to adjust. And I was lucky that I had some equipment in my house, but not enough to do what I wanted to do. But with my background and my training, just like all of you, I could get creative and I made it work. I was very happy with what I was able to do for that period of time. But take our customers, take our clients, our patients. One, they don't have the skill set we do. Two, especially in the Medical Fitness Association market, they may be dealing with other health issues. So for them to exercise on their own could be potentially not advisable. And they may not have any ability to have something in their home or understand that. So what happened? Did they just get disconnected? Did they just lose sight of their programming? Or how did we stay connected with our customers and our clients? And now going back to the statistics I showed earlier, that people are very concerned about being in facilities. And then when you elevate that potentially with the group of people who may have conditions and other circumstances from a health standpoint, they may even be more concerned than the 25 to 35-year-old that might go to a normal brick and mortar facility when it opens back up. So what do we do here? How do we increase revenue and redefine our business to make sure that we can stay connected with our customer base, especially when you see this rapid drop in activity? And we all know, I don't need to put slides up on this, we're all professionals here. We know what happens when people stop being active, right? It is not good, especially in that certain population that have those pre-existing conditions. So we want to make sure that we have solutions to that. And I'm sure a lot of you got very creative. So this is very interesting. We just showed from IHRSA how more and more people are in the gym and paying for gym memberships. But now when we look at the statistics for 2020, 40% of Americans are obese. Healthcare costs of the physically inactive exceeds $117 billion a year. So the fitness industry generates $35 billion, but the inactivity industry, healthcare, has a $117 billion price tag to that. So clearly, we all know this, that if we can increase physical activity, it has never been more important to the nation's health and economic outcomes, but then we have COVID simultaneously. So it's the perfect storm of chaos that we're trending with obesity, and we know we need to get people more active, and then we shut down the world. So again, we're gonna figure this out, and together we can make this happen. So when you see some other statistics here, more than 80% of adults do not meet the guidelines for aerobic or muscular strengthening activities. Interesting, because we're seeing more and more people in the gym. So obviously they might be paying for the gym membership and not going enough, or maybe they're false reporting their activity levels. But we know that people are very unhealthy by and large in this nation. And now more than 80% of adolescents do not do enough aerobic physical activity. I can tell you my favorite class when I was in all the way through high school was phys ed. And we know that in certain parts of the country that had been removed and it has come back, which is great. But now the homeschooling, all these other factors in play are potentially keeping children who before this were inactive and not meeting the requirements. And now we throw in the COVID. And again, there was a bunch of studies I could have pulled on, the nutrition during COVID and all that. But, I didn't want to belabor all those points, but we know that it's very healthy for kids to be around other children in the school environment and getting their normal routines. So it's going to be a very interesting year as we finish out 2020. But I think there's some really important community outreach that when we study these statistics that all of you can do, however you think best in your areas, depending on what's going on, to really make a difference in these populations. So some interesting or startling statistics. So when you look here from the World Health Organization, obesity is being defined as having that body mass index equal or greater to 30, as we all know. So when we look at 1975 to 2016, and again, this is still trended upward, we're well over 30% and now towards 40 when you saw the 2020 stats of adults that are obese. Now you can see here, Europe has kind of, kept pace for a while. It's there, they might be slowing their rate down, but still increasing. But some interesting other countries like Africa is now over that, moving towards a 10%, Southeast Asia. So again, we are clearly in the lead, unfortunately, followed by Europe and then, Eastern Mediterranean. But this is a startling statistic that we need to drastically try to curb. Now, when you put overweight and obese, so the overweight are those people not quite at 30 BMI, but 25, and most of those people are trending towards moving towards 30. Now look at our percentage. We are over 62 to 65% of adults are either overweight and or obese. And again, we could have done a whole hour conversation just on the healthcare costs and the effects of obesity. That's not what we're here to discuss in full today. But clearly, this is a trend that we need as the leaders in the industry to try to get into our communities, get people engaged, keep them engaged, and see if we can change our local communities. So you'll see here, there's a drastic increase in everyone's markers, but obviously America and Europe are clearly leading that charge here. And that's not something to be proud of, but we are now over 60%. So now another statistics I found interesting here, and I will be the first to point out because I would have noticed it. This was not a 3,000-year study. This was something I could not change. They made the typo. You can see my reference here. This would have been 2005 to 2006. So I just want to point that out because that had been the only thing I'd been staring at. So prevalence of obesity among US adults aged 20 to 74. So once again, you can see a sharp increase. This is what I really wanted to point out in this, it was a steady, now I wouldn't even say slow, but steady increase, and then a sharp increase from 2010 to what's projected in 2030. So this is the projection in 2030, but we're already at 40% at 2020. So the trend line is not in our favor, especially when we started the decade out here in 2020 by decreasing activity by 45%, getting people potentially more afraid to take care of their health, and possibly not getting them comfortable to go back into facilities. So didn't want to be the bearer of bad news, but we're all professionals here. We just want to know the statistics. So the epidemic of obesity is impacting the severity of COVID pandemic. We know that the people that don't do as well with COVID have pre-existing conditions of a variety of sort, but clearly age and then the metabolic conditions are definitely not helpful. So the increased risk of severe illness, you can see here, triples the risk of hospitalization, linked to impaired immune function. Definitely something that's scary here is that decreased lung capacity. And then interesting here, as BMI increases, the risk of death from COVID-19 increases. So again, getting that person even from the obese down to overweight would be a great goal. And then obviously different populations, Hispanic and non-Hispanic Black adults have a higher prevalence of obesity and more likely to suffer worse outcomes from COVID-19. And you can see here, this is referenced very recently from the Center for Disease Control and Prevention here in 2020. Okay. So as we continue on, obviously it's like, well, what do we do? How do we make this change? And I really think when I look at the entire industry, I do a lot with the fitness industry. I'm very passionate about the fitness industry, but I always love when I'm talking to medical professionals because we see things a little differently. We have a little different background. And, obviously we might take a more evidence-based approach to things. We may have a more clinical-based approach to things because we have absolutely the best data and science behind us. But when we get towards the end of the presentation, we'll talk about how do we make that fun? How do we make that engaging so people want to participate? Because at the end of the day, no matter how much we know, people need to check the boxes of what we want them to do, if they're not enjoying it, then they're less likely to do it. Then you throw in any obstacle such as the pandemic and any obstacle such as the fear of being in facilities, etc. It's an easy out for people. So we know we need to engage people and get people to move. So the factors here that we all know that negatively associate with adult physical activity, obviously advancing age, lower income, clearly the lack of time, truly the low motivation, potentially the rural residency, perception of great effort needed for exercise, overweight or obesity, perception of poor health, and being disabled. Now, I'm going to pause here for a second. So I kind of gave you a heads up on that I didn't do my doctorate on the healthcare versus disease care state. What I did my doctoral research on is why people don't exercise. And I'm not judging by any means. I wanted to know because to me, it just makes sense. I love the human body. I love understanding the human body. I love exercise. I love being healthy. And I would tell you that if you took a study of people at a 5th grade education or higher, everyone understands that it's important to be healthy, right? Very few people don't want to be healthy. They may not want to do what they need to do to be healthy. So that's where my research showed pushed me, because as much as I love the new research on exercise is beneficial for this, this, or this, I was like, all right, at the end of the day, if no more research comes out about how beneficial exercise is, I think we got enough on the shelf to know that exercise is beneficial. No one's going to say, oh my God, new research, stop exercising and you'll be healthier. So I felt comfortable there. So now I'm looking basically, okay, why do I love it? And why do a lot of people don't? And there's going to be a lot of factors here. But I was able to do some research, and what we found out was there's 3 main personality types on how people perceive exercise. There's what we call control. And these are people that they'll do it for a 5K. They'll train for an anniversary, a wedding. They'll train for a half marathon. But as soon as their goal is over, if you don't reassess and maybe get them back on a target again, they don't necessarily continue with the exercise. They have to have that carrot to chase. That's what motivates them. Great. Then there are autonomous. Autonomous is I need to know the why, and I need to have some control in it, and then I'm in. So if you can tie it to what's important to them, give them some input to it and explain it to them, then they're like, okay, I now understand 1 + 1 is 2, makes sense, I got it. But the part that really interests me was the third, because I've known so many people that fell into this. And as a fitness professional, the people I got the most joy of training, and I've trained the New York Yankees, I was a strength coach, I've trained everybody. As much as it's amazing to train a high level elite athlete, I really got the most joy of training someone who was afraid to exercise and thought that they were doomed to fail. So interestingly enough, the third personality type, impersonal is what it's called, they think that they are destined to fail. They think exercise has to hurt. They think that everyone in the gym is in shape. They think everybody's looking at them. So looking at it, guess who makes up a big percentage of the people that are obese, overweight, lack of motivation? Not 100% by any means, but there's a big percentage of people there that are intimidated and afraid. Now, I put my gym hat back on and I watch how personal trainers and coaches sometimes respond in the gym, and it's high level energy, motivating, maybe yelling. That can be okay. There can be a place for that, but maybe not for every personality type. What if somebody in that facility is like, oh my God, they're like yelling, they're gonna yell at me, I feel bad about myself enough already, right? So again, it's very interesting to find out that maybe we don't need to treat everybody the same. Maybe we need to teach our staff how to have potentially different scripts and pick this up on how people view exercise. Because when we look at this right column, can advancing age be overcome? Absolutely. Can low income be overcome? Absolutely. Lack of time, I don't want to hear about the time. I got a slide come up in that in a minute. Low motivation really can come down to it's not speaking to me the way I need to be spoken to in one of those 3 motivating factors. Perception that exercise has to be really intense. So again, that's that solution that we know as medical professionals. So I truly believe all of you on the webinar today have such an amazing ability to get out in your community and change the game, because there's so many people out there that really truly need to be under the guidance of a medical professional, whether it's physical therapy, athletic trainers, medical doctors. There's so much to it. But now let's shift to how do we make it engaging and fun, and we will talk about that. So clearly here you can see more US adults are moving, but not enough. We need 115 minutes a week, 2 days a week of muscle strengthening. And then you can see here adults only 24% get enough. And you can see that, you know, in different areas, urban to rural. So we need to understand the people, understand what their objections are or what they are perceiving towards exercise, how they personally think about exercise, and then arm our facilities with the right resources to make sure that those objections and those mindsets aren't there, and then it's fun. And I absolutely think everybody here has the most amazing staffs in their facilities to accomplish this. Now, this is what I call the apple or apple pie theory. Okay, so again, I take my 5th graders and above, and I put an apple and an apple pie on the table, and I say, which one's the healthy choice? Everybody knows what the healthy choice is. Doesn't mean they'll choose it all the time, right? So when we look at adults ages 18 to 64, cardiovascular disease, cancer, and diabetes now cause 70% of US deaths and account for nearly 75% of healthcare expenditures. And again, the majority of these behaviors have some contribution into lifestyle choices. Not all, right? Not every disease is due to the way you live your life, but substantially higher now than 100 years ago. So that's what I call the apple or apple pie theory, is people know what they need to do, but they continually choose the wrong choice. And then eventually there's a price to pay for that. So how do we, in this Medical Fitness Association, make and break that cycle? And I really believe with all the doctors that you have that can refer to your facilities, and again, that higher level of education that you guys offer with your staff, I truly believe that this could be an amazing answer for all of your communities to really get in there and make a change. And I just, personally, I prefer pumpkin pie. It's that time of year, but I'm just saying. So you guys can do a poll at the end, apple pie or pumpkin pie. So now we're going to look at factors that positively associated with adult physical activity. Post-secondary education, higher income, enjoyment of exercise. Well, how do we get to an enjoyment of exercise? So I kind of talked about that with the personality types. Expectation of benefits, belief in the ability to exercise, brought that up a little bit already. History of activity in adulthood, social support from peers, family, or spouses. Now, let's pause here for 1 second. When you look at trends in fitness over the last 10 years, there's been a major shift towards the boutique experience. And I'm going to be honest with you, I was in private country clubs prior to joining Technogym. And I was like, boutique experiences won't affect me. People join these private country clubs, they pay tons of money to join, they live here. Well, guess what? And Orange Theory Fitness opened up down the street, and I was like, wow, they're willing to pay an additional amount of money for a workout I can't provide. And I'm like, wait a minute, it's not that it's a better scientific, it's not that it's that it was an experience, it was a sense of community, it was people being holding them accountable, it was this social support from peers, potentially family or spouse. So I don't know every single facility of all of us that are on the webinar today, and I know that in the MFA network, there's been a change in how medical fitness associations, your facilities are being operated, as well as what you're offering. And I know the trends have changed, so I'm not definitely making a blanket statement. But for a long time, medical fitness was thought of a little more therapeutic based. So I know that so many of you have done an amazing job changing that. And what we can tell you globally, it is not going to change. Due to what I studied in my research, how people perceive exercise, due to the fact that this generation of people definitely want a social support, they want a sense of community, sometimes they'll throw out the science and they'll go to programs that may not be as scientifically sound, but give them a sense of belonging, community, and all that. So it's something to think about as you might want to pivot some of your offerings. access to and satisfaction with facilities, of course, enjoyable scenery or environment, and then safe. And this was from Healthy People 2020. So very, very recent. I mentioned this before, we want to transition from that sick care to the health care. And we all understand why insurance pays for some things and not another, but let's just talk about our offerings. Can we get out in that community and start to decrease the obesity, decrease the overweight, decrease all of those other health factors that can lead to higher, higher medical bills, higher medical costs, less productivity at work, or the increase potentially from having a worse outcome from things such as COVID-19. So this is where I love to spend my time personally, my money personally, and my energy. I want to try to stay away from this as much as possible. So I love this. I've been using this cartoon for years as a fitness professional. What fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? I know it's a little harsh, but you can find it on the internet. I don't know, maybe it's just my sense of humor. But I like to hold people accountable because people will always make excuses. And I have 3 boys, and what I always tell them, show me what you're doing and I'll show you your priorities, right? Again, this is just me. I get up at 5 o'clock in the morning. I've always been a morning person. I have my morning flexibility routine, and I carve out my hour during my day to get my workout in, and then I fill everything else around my day, just like a lot of you do, I'm sure. So how do we start to transition the people in our facilities to really take this as a priority? So when we looked up healthcare, when I was talking to Jason about our content today, I was like, here's kind of where I want to go with it. So I looked up the definition of healthcare. It's the organized provision of medical care to individuals or a community. I was like, okay. But I was like, maybe we can do a little better. So this is my definition. Organized provision of fitness interventions in order to decrease the future medical care to individuals or community. That's what I personally, I'm not speaking even for Technogym at this point. This is Marty Miller. That's what I want to see. And that's why I went and did my doctorate in health sciences, because we're looking at global outreach in communities. That's what the doctorate of health science does. It takes all the amazing research and then tries to implement it to get better outcomes. So I want to help shift that focus to the organized provision of fitness interventions in order to decrease the future medical care to individuals or community. Because again, medical care to me is that disease care state. So we'll have time at the end for comments and questions on that. But again, that's just something that, how I view it. So now when we look at opportunities for medical fitness community, so from a business point of view, it behooves gym owners. And again, I'm lumping everybody from medical fitness in there because you have people in your facilities that are there to get healthier. So we don't want to necessarily send them out to other gyms if that's something that you can offer. To learn which insurance companies provide group coverage for businesses, then creating a package whereby participants in fitness programming can receive that reduced rate for health insurance. Obviously, you guys are leading the charge in that. So kind of having this whole integrated approach. So imagine that world in which doctors, personal trainers, physical, occupational therapists, chefs, and dietitians come together, offering services to clients with a single location. Now, I bring this up because this wasn't written for the MFA members. This is what's going on in the National Federation of Professional Trainers. So to me, you guys are already set up for this if you're not already doing it. You have doctors, you have physical therapists, you have occupational therapists. Is it time to go get chefs and dietitians to come together? Because I promise you the big box gyms and the other locations in your area are already starting to identify how they need to rebrand themselves. So you guys are a step ahead already. Just let's get that fully integrated model that when someone comes in, they can come in for healthcare instead of disease care. The disease care, I know that's not, I'm just trying to separate the two, that it's there if needed. But let's get people into your systems before they need it. And then let's give them all their answers in one location. So one suggestion involves medical professionals seeking out top fitness experts. And right away, I can tell you, I've worked with amazing physical therapists, some of the best in the world. And they could say, I'm not a personal trainer. I don't make workouts engaging and entertaining. So, okay, and a personal trainer can't go do joint mobilizations and can't do diagnosis right? So let's get the right people in there together and let's make sure we have the right credentials. coaches, group exercise specialists, personal trainers, and forge those relationships. Instead of a general exercise prescription or suggestion, doctors can directly refer patients to classes and gyms, even going so far as to facilitate that introduction to a new member of their expanded healthcare team. That again is what we're trying to do with Technogym and obviously with all our partners. Just like I said, that definition of true healthcare. Let's get fitness interventions out there sooner. Let's have that cooperative team, and then we know we're going to get better results and keep people away from more of the traditional healthcare needs. And we would love to be your partner in that, of course. So how do we solve these problems? So clearly, the CDC's got some suggestions. I stole something right here, the medical fitness risk model that you guys all know from Medical Fitness Association. So neighborhood design, access to healthy and affordable food and beverages, access to safe and convenient places for physical activity. Depending on where you're at, get outside and go out and get an amazing group exercise instructor. Get people to recognize that your Medical Fitness Association isn't just for physical therapy. Go do exercise programs in the parks, etc. And then the World Health Organization suggests sustained implementation of evidence-based and population-based policies that make regular physical activity and healthier dietary choices available, affordable, and easily accessible to everyone, to particularly the poorest individuals. Get out and get into that community. So a great quote from somebody you may have heard of before. So I wanted to give Mr. Boone here, some credit for these amazing quotes. So if a health club can meet all these criteria, it can do the work of becoming a part of the local continuum of care and become fully integrated within the healthcare continuum. So exactly what I was thinking about when I crafted my definition of healthcare. Referral to exercise is not top of mind for medical community because physical activity is not yet widely adopted as the fifth vital sign. Absolutely, totally important. As I said before, I chose to do my doctoral research on why people don't exercise, because if we stop producing research, I think we have enough to show that exercise, is the best vaccine for everything we face from a healthcare standpoint. So we have a global and national community type of approach, as well as the policies and systems. So you can look globally, and that's what Technogym is, a global leader, and we can help share that. You've got your national resources, your community, and then you have your policies and systems. So just some things here as we get towards the end. World Health Organization, create active societies, create active environments, active people, and active systems. And then again, IHRSA, a new partner for MFA, is Get Active for All pledge. This campaign aims to raise awareness of the importance of access for disabled and other underserved populations in health clubs all over the world. And I know this partnership is new, but when you look at how you may be changing your business model, you may need some of the greatest fitness professionals out there. You may need now for IHRSA to start doing more education on corrective exercise and all of these more specializations that your current team would not have the time to implement, but you bring in fitness professionals, whether it's group, whether it's personal training, so they can raise the bar from their knowledge to how they work well in a medical fitness association facility. And then from Technogym, we've got this coming up here in November. It's usually a month almost in March, but we had to shift. We have a week of this. What we do is what we call Let's Move for a Better World. It's a social campaign that we do with all of our partners where people track their activity globally and compete in a fun way. So it aims to further the promotion of exercise and contribute to the fight against the global obesity pandemic. So just some great ways to do social causes to get people more involved with being active. So perfect transition here into our Let's Move for a Better World Week. So if you're one of our facilities, we help promote it. You promote it in your facility. You track everyone's activities through what we call moves, which is doesn't take in body weight. So someone could walk, someone could run, someone could do other things, and the facility collects as many moves they can during the week, and then we have a global competition. So just a real fun way to get people engaged. Again, people are looking for an experience. They're looking for that sense of community. So why not participate in these type of activities? So you can see we've been doing this for over 20 years. That is that wellness is a healthy lifestyle based on strong belief that wellness is a social opportunity for individuals and society as a whole. This is, again, kind of just real briefly showing you our mission is to help people live a better life, and that wellness means more energy, greater efficiency at work, living longer, mental, physical, and social well-being. So we take this true holistic approach. Even though some people see us as an equipment manufacturer, we do so much more than just make amazing pieces of equipment. So I like to control the narrative. So we took this from American College of Sports Medicine. So increasingly, public health research shows that to improve health and fitness, prevent disease and disability, and enhance quality of life for all Americans through physical activity, we must create a culture that integrates physical activity into our daily lives. We have to control the narrative. We have to get people to understand the importance and make it easy, accessible, family activity potentially, and most importantly, fun and safe. So Technogym has the wellness on the go strategy, where again, it's not just about pieces of equipment. It's can we help people be active at the gym, in their home, outdoors, at a hotel when they travel, just their simple daily movement. Can we get that information to their doctor's office and even at work? So the complete wellness on the go lifestyle strategy, that is our Technogym digital ecosystem. So I mentioned this very early on. People all of a sudden that were brick and mortar, all of a sudden were not able to connect with their members. So we have been a smart digitally connected equipment company for well over 15 years. This is not new for us. So we were positioned very well to help our partners start to move to a digital aspect to stay in contact with their members. Because again, I go back to controlling the narrative. If you weren't prepared for a digital world and they could only get your content when they came in the facility, COVID happens, guess what? The people that were interested in working out went and researched and found somebody else, and now have their habits changed, and will they come back to the physical environment after this prolonged period of time? So we want to make sure that what we call phygital, if you can imagine that, physical and digital is the way for the future. You still want your physical location, but you want a digital presence, so that way if somebody's not feeling well, they can stay home. If they're traveling, they're still staying in your ecosystem to be your client, your customer. So we did some studies, individuals 12-week exercise program designed through the My Wellness Technogym Cloud based on the participants' cardiovascular risk stratification, you can see here. Absenteeism, presentism, and productivity loss were estimated based on the effect of the intervention. So we found that the digital aspect kept people accountable and kept people working out. And this was just done in October of 2020. So these are some of those results. Again, I want to make sure I leave some time for Q&A. I can always send this in to Jason to send this out, but you can see some pretty impressive numbers from that study. So here, body mass index, cardiovascular, VO2 peak. So great results from keeping people connected digitally. There's some other efforts out there from ACSM, the fitness index, healthy people. So these are things that you guys are well aware of that you know, you can continue to push forward from a national standpoint into your facilities. Now, the last thing I'll talk about before we show a couple quick solutions, then have time for Q&A, I could talk about this all day, is exercise versus training. I've been an educator in the fitness industry forever, as well as in the sports medicine industry. Exercise to me is activity requiring physical effort carried out to sustain or improve health. Yes, just moving. But really where MFA has a huge opportunity is due to the education level of everybody on this webinar. You can take your activity into a training activity. The action of teaching a person a particular skill or type of behavior for specific outcomes. Basically, exercise is anybody that walks in a gym and just tries stuff. Yes, they'll get some benefit, but they could cause injury. Training is an evidence-based approach to elicit a specific physiological response. So again, all of you here with this amazing education and background have that opportunity to provide unbelievable training experiences for your clients, customers, or their family. Be the expert in your area. So Technogym, I said we were the Olympic provider of all equipment, and from that was born the skill line, which gives us unbelievable data. Here you'll see our skill run allows us to do sled push, running, parachute, analyze right versus left. So this is just some of the technology that we take from what I said at the very beginning with all of our PhDs, all of our athletic trainers and strength and conditioning specialists, physical therapists, and then we create a solution. Now, I did talk about an experience. People want an experience. So again, listening to the needs of our members, customers, we created multiple concepts where it's a boutique experience that you can drop into your facility. We create the floor plan, we create the education and the content. So it's a plug and play, but it's all based on amazing science. So here what you'll see is what we call Skill X. So now, instead of somebody leaving and going to a boutique studio, maybe you put this into your facility, and now there's consistent programming delivered with consistent education to give you consistent outcomes. So now your personal training business or your revenue is not based on one coach, and whether they leave or not, you have created a business model that's been proven and that is reproducible no matter if you have staffing coming in and coming out. You'll be able to email me or any of your reps that introduced you to Technogym. Obviously, they'd have all this information, but just giving you some ideas on how we are looking forward and taking our science and then creating solutions. And then again, we are partnered with PGA Tour. We just did a golf summit with David Ledbetter and some other amazing people in the industry. So we are the sole provider equipment for the PGA Tour trailers. We created the Technogym Golf Performance Program. So how many golfers do you have in your facilities getting treated for low back pain, hip pain, and then they leave? Well, why not keep them there and have a corner as a performance corner? It could be other things than golf, but this is a complete drop-in, plug-and-play model that you can either go out and market to the local golf community, and or when your golfers come in, now they don't have to leave to go somewhere else for their performance training. So these are just, again, some ideas that I wanted to drop in on, that Technogym is a solution provider, smart digitally connected equipment with solutions. So these are just some of our partners. I'll be doing some things here with Ironman in the future. So once again, maybe that's something there. You use our knowledge with Ironman to go out and get all the local triathletes in your area to come in and experience what you guys have to offer, from injury prevention, all of those recovery techniques, all of those amazing things that our local Ironman athletes would need. Partner with Michael Johnson Sports Performance. We're coming out with a speed development course. You see USTA, PGA Tour of America. So these are those pockets of people that have shown that they want to stay healthy and can use professional advice and guidance in their programming that you could offer. So these are just some of the amazing partnerships that we have that can then benefit you in your facility. So I think I finished. I told Jason I'd probably be 55 to 60 minutes. I'm right there at 58 minutes. So Jason, hopefully I didn't overwhelm anybody, but covered enough, and then we'll see if there's any time for any questions.
Great presentation, Dr. Miller.
Excellent, thank you. And I'll leave my email up there in case anyone has to jump out, but I'm happy to stay on and answer any questions.
Awesome. Well, this is Mary Ann. So if anybody has any questions, you can go ahead and put them in the question section or in the chat section. We do have one question. Actually, this comes from Bob Boone, who said, thanks for a great presentation.
Thank you.
He's asking, how do we, meaning MFA, motivate our member facilities to gather outcomes data as part of their daily workflow?
Sure.
There's a lot of people think it's too high a bar to collect outcomes data, but there is an opportunity. But is there an opportunity with digital capture of data?
Yeah, and that's why, when I came to Technogym, I was blessed that they approached me, and because of my science background, I was a customer. And I was just so enthralled to come because of these type of things. They make it so easy. So all of our equipment is smart digitally connected equipment, and we have a free app called the My Wellness app. There's no charge. You don't have to develop your own app. So every time somebody logs in, we are collecting that data. And depending on which equipment, which solutions you buy, but you can enter even, body weight exercises and all of that. So the data collection becomes very easy. And when the customer starts to see their performance indicators go up, now they want to track more data. But when you have, a lot of different type of equipment that's not smart digitally connected equipment, it becomes manual. Yes, it's hard. Every time I can pick up my phone, I did a test on my skill bike today. And I'm like, all right, it's the 3rd of the month. It's time for me to do my 3-minute power test. And, I started to track everything, and I kind of geeked out about the science. And now that makes me want to do more training. yes, I'm a fitness guy, but everybody likes that input and that feedback to know that they're moving towards something. And that's been the DNA of the company the entire time. Hence, when Mr. Alessandri called it techno for technology, gym for fitness 37 years ago. So we try to make it as simple as possible for you. And then we get it an application that you can push exercise programs right to your clients' phones. So now it's even easier for them to follow along.
That's great. Well, thank you. Well, while we're waiting to see if we have any other questions, I do want to point out one thing, Dr. Miller, you talked about this, about kind of how trainers are talking to the people that they're training, and different people take, not everybody reacts well to yelling, or maybe people are really motivated by yelling. And I just want to point out to everyone that there is a pre-recorded session at our annual conference that discusses weight sensitivity at your fitness center. And that's Amber Bjornvelt is doing that. And her thing is to learn how language, equipment, and actions can be insensitive to overweight and obese individuals, and learn how to fix it. So to keep those folks coming back and to make sure that they're comfortable at your fitness facility. So I hope folks will check out that session.
Yeah, that's gonna be great. I'm gonna check that out too. So, I probably have to spend a little more time. I'm gonna generalize here when I'm dealing with personal trainers that are gung-ho to get in fitness. And what I always say is, let's strip this down to the basics, that more people than not are not going to be motivated by pure yelling. If you have one of those people that is motivated by that, like your football players, etc., remember, when you're in an environment where everybody is more like, sometimes it's easier to identify that. But I always say you're never going to go wrong with positive feedback. You're never going to go wrong with whispering in somebody's ear if you have to, going, hey, you usually have more. What's going on? You don't have to scream that across the gym. And then what I always say is I never make a comment on how somebody appears, their look, because we all understand that people perceive their body differently. And I always give my story is I got into this because I was the skinny kid, and I'm 40, I'll be 48 years old this month. And if somebody, and I've got some of my colleagues on the line and they know this, if somebody comes up to me and says, hey, did you lose weight? That in my brain, no matter what happens, that's never going to be a compliment to me. So people are always going to be sensitive. So I always use things like, hey, I can't believe how good you're doing. This is amazing. Look at your progress, right? I don't ever say anything about their general appearance because you just don't know what those triggers can be. So I always err on the side of caution. Maybe that's the athletic trainer in me that, our background is to always do no harm physically, but also emotionally. And, I know that in these boot camps and all that, there's a lot of screaming. There's ways to motivate and there's ways to intimidate. So we always shift towards positive feedback, careful about comments about appearance. And if you need to motivate somebody, that should be, where you walk up and kind of put it in their ear instead of screaming across the gym to somebody else.
That's awesome. Well, we don't have any other questions. We have one comment that's an excellent presentation. So I believe it was enjoyed. Actually, I do have a question. What do you think the top 3 strategies are to encourage our healthcare professionals to refer us to medical fitness professionals?
Gotcha. I've worked with a lot of doctors. I think the key thing is to, obviously they're going to know that you're going to take an evidence-based approach, but it never hurts to show it to them and, really show them the depth of the staff that you hire. But also, depending on how much time they give, see if they'll come in for a workout themselves so they can experience it. That's always a great thing. And then also, maybe give them some best practices, maybe like everyone, I hate to say this nowadays, is we're in the Instagram world. We don't like to read much as we like to watch a video. Maybe you give, 4 or 5 of your clients that have given approval to give a quick 30-second, hey, this is what this did for me. Because if a physician can take that 30 seconds and say, wow, you went from going there for rehab on your knee, and now all of a sudden you went and you continued on, you lost 35 pounds and your diabetes is under control, things like that will resonate. So I just think that's the world we live in now, is where people need that quick information, and video sometimes captures emotion and professionalism more than just the written word. So, and I think that where the gyms do a really good job, maybe more than what we do when we're in these medical environments, they make everything Instagrammable. So maybe we need to move towards that just a little bit to make it a little more trending in the right direction. That's where having an app and having these cool concepts in your facilities moves the bar. And I know there's been some amazing progress in the MFA partners and people that work in this environment, but it's, you know, I think we can continue to push that envelope a little bit.
That's great. Thank you, Debbie. Hopefully that answer was helpful. So just to let folks know while we're waiting to see if some more questions come through, we will put Dr. Miller's presentation in his section for his speaker session, and then also in the Technogym sponsor page on the Crowd Compass platform for the conference. So it'll be available in both places.
Thank you, Mary Ann. And thank you, Dr. Miller. Great presentation, very insightful. We just want to remind everybody we have keynote number 2 tomorrow at 2 o'clock Eastern time. Dr. Tyler Cooper, who's the president and CEO of Cooper Aerobics, will be joining us on an introduction on improving the quality and quantity of life. And also tomorrow night, please join us at 8 o'clock Eastern time for our welcome virtual reception. Can't wait to see everybody there with cocktails in hands and catch up and see everyone's smiling face again. So we want to thank everyone for attending once again, and you as well, Dr. Miller, and hopefully you can join us tomorrow night.
Awesome. I will do my best. Thank you.
All right, everyone, have a great rest of your day, and we'll see you tomorrow.